Now, it's not just the states, of course, notifications have also gone from the health ministry to different other union ministries as well in order to bring in a coordinated strategy to fight the pandemic. And one such missive has actually also gone to the Union Ministry for Civil Aviation. Now, what has the health secretary actually told the Civil Aviation Ministry? One of the recommendations is that 2% of passengers in flight will be undergoing random post-arrival testing. Now, this is a process that has already been initiated. Travelers to be identified by the airlines concerned, preferably from the different nations. So ultimately, the airlines will take a call as to who these random passengers are who will eventually be tested. Earmarked travelers will be submitting samples and also will be allowed to leave the airport. So therefore, they won't have to stay in the airport for an extended period of time. Their samples will be collected, after which they'll be allowed to leave the airport. If found positive, samples to be sent to INSECOG lab network. Now, this is, of course, a process that is absolutely imperative to ensure genome sequencing. So those samples that do turn out positive will be sent to INSECOG to facilitate the process of genome sequencing. Mandatory masking up has not yet been made a recommendation so far. So that is something that is still awaited. So therefore, the restrictions are not as stringent as they were anticipated. So for now, masking up has not yet been made mandatory, but there will be random testing of passengers. So therefore, the situation on the ground is not something that has yet elicited panic. Random sampling of 2% of airport arrivals. So that is something that has also been recommended by the Health Ministry to the Union Ministry for Civil Aviation. So that is an important step to actually ensure that those samples that do turn out positive will be sent to INSECOG for further genome sequencing. So therefore, people should be on vigil, they should be on their guard, not drop their guard, and yet at the same time not start panicking. That is an important prescription that's come from the center. The active caseload, and this is something that our graphic now also captures, has actually been falling over the last 8 months. In fact, day-to-day caseload has actually fallen. It was about 3,600 cases yesterday. It's actually fallen now to about 3,300. So therefore, there's no reason to panic. That's one important recommendation coming. The positivity remains at a reasonable 0.14%. So therefore, the positivity rate is basically the percentage of the samples coming out positive out of the total population that is actually being tested. No active cases in 4 states and union territories as well. So therefore, that's another positive sign. Basically, the active caseload overall nationally falling. 220 crore vaccine doses have been administered so far. There's a slight point of worry here because the number of people who've been administered the booster dose so far only stands between 28% and 30% so far. So that is something that needs to be addressed. Let me in fact go across to Dr. Sanjeev Bagay of Nephron for a medical perspective on this entire matter. Dr. Bagay, 30% booster dose, so that is a percentage that actually needs to be in fact increased. Also
to cover the gap so that the maximum number of penetration happens for the second dose. Again, a golden opportunity because we have a window period now in which the caseload is still low, that we push for the third dose, which is your booster dose, to make you fully vaccinated. With regards to the intranasal, it is the most wonderful step. It is easy, it is very quick to administer, it's a very low cost, and it can be used as a booster, so it will work as a heterogeneous platform. It stimulates what we call as the secretory IgA. It gives you a nasal mucosa protection, and it stimulates your lung T cells, the residence T cells, to kick back your memory. So you have a dual advantage with this. So it protects you from the site of entry of the virus, and it stimulates your resident T cells in your lungs. It has a very, very good efficacy, wonderful step, and we can do almost 1 crore a day once we start pushing at it. It has practically no side effects at all. It's an inactivated vaccine and highly recommended. We should push for this very, very aggressively in the age groups as recommended.
Okay, thanks a lot for that perspective, Dr. Bagai. Let me take this across to Mohit Bhatt as well. Mohit, what's very interesting about the COVID scenario in India is the fact that the active caseload has been falling consistently over an extended period of time. It's actually down to about 3,300 overall cases so far. So therefore, we are in a reasonably good position right now, but still the government is not being complacent, all the necessary precautions being taken.
Well, so that is what the government is saying. We do not need to be panicked, but we need to be vigilant. We know for a fact that our cases are going up in China, in Europe, and in United States, and hence we need to be very vigilant. Now, our cases are not so high, given the fact that how the vaccination process, that the vaccination drive of India has been going on very smoothly, and the immunity that the people of the country have got from the vaccine is something which is very, very important and which is very strengthening. But the health ministry has also stated that we need to be vigilant. Whenever we go out in crowd, we need to wear masks, and also we need to maintain social distancing. Now, Siddharth, the festive season is coming up. On 25th, we have Christmas. The New Year Eve is also coming up. We'll have the large gatherings, and that is where the magnitude of COVID can also spread, and that is why Prime Minister Narendra Modi yesterday held a very, very important meeting, and it was a meeting on COVID after a long time, which was being chaired by Prime Minister Narendra Modi. PM has clearly stated we need to be very, very vigilant. We need to mask up. We need to maintain social distancing, and our hospitals need to be prepared. And that is why we'll see a mock drill on Tuesday in our hospitals all throughout the country. Mansukh Mandavia, the Union Health Minister, will himself be going to a hospital in Delhi, and a mock drill will happen, and such mock drills will also happen in various parts of the country. Because remember, Siddharth, during the first wave, second wave, the hospitals were completely filled with the patients. There was a lack of oxygen, lack of beds, and hence many people lost their life due to COVID. And hence the government does not want rerun of that, and that is why the mock drill would be done on Tuesday. The government clearly says that we are not enforcing the order of wearing masks, but people themselves need to be vigilant. It's also responsibility of the people on the ground that they need to mask up whenever they go in crowd. They need to maintain social distancing, because we do not want rerun of what has happened in the first and the second wave. So that we have been reporting on the first and the second wave. We saw people dying due to lack of oxygen, lack of beds, lack of health facilities, and it was a very, very scary sight. We do not want rerun of that, and that is why we need to be very vigilant. In some time from now, Union Health Minister will also be having a meeting with the health ministers of different states, and we can expect that certain guidelines will come, certain advisories will come, but as of now, the government has made it clear.
That's a meeting that you rightly mentioned will take place in about 2.5 hours from now, presided over by the Health Minister of India, Mr. Mansukh Mandavia. It's a good time to actually recap the advisory that has gone from the centre to all the state governments as well, something that will be further formalized following the conclusion of that all-important meeting later today. So what are the recommendations being made in this advisory? Wearing masks, not mandatory, but advised. So therefore, no serious stricture about masks being made mandatory, but it's definitely something that is recommended. Adherence to COVID-appropriate behavior. This, of course, includes social distancing as well, and proper sanitation measures, including of the washing of hands using sanitizers. Advisory 3, awareness on uptake of precaution dose. This is very important because approximately 719 million Indians out of about 920 million have not taken the precaution dose so far, according to one particular estimate. So that's a slight point of concern. Mock drills in all government hospitals. This is something that's going to be conducted by the Health Minister himself in coordination with other states on the 27th of December, which is the coming Tuesday. Fifth advisory, create COVID awareness during festivals. So, of course, it's the end of the year. Also, there's Christmas coming. So, therefore, all the more reason to be vigilant. States will be issued advisories after the meeting. So there's one particular meeting going to be held in the afternoon today with the Health Minister in coordination with the Health Ministers of various states, where another advisory will be formalized. Strict vigil as spike in various countries. Of course, India in a far better position, but that's no reason for us to be complacent. The United States, Japan, principally China, are facing a fairly dire situation right now. Now, my colleague Shivani actually had the opportunity to speak to one of the primary stakeholders in this matter, Dr. Suresh from the LNJP hospital, and here's a ground report on the steps being taken by some of the most prominent hospitals in this country to contain the spread of the infection and be on our guard.
As China, Japan, United States face COVID emergency, how prepared is India? To talk more about it, I have with me the MD LNJP Hospital, Dr. Suresh Kumar. Sir, a very warm welcome on Times Now. If we talk about the preparedness, how prepared are we?
We are fully prepared. Government of Delhi has given us instruction that all the beds, all the ICU must be fully equipped, and we must be ready for any new sub-variant or new mutation which is emerging. We have seen that the many countries like China, Brazil, USA and Japan are seeing the large number of cases. So this time we are fully prepared and we have done the preparation at a war footing level. You can see that all our ICUs are there in place. All our staff we have already trained and sensitized for this new variant, which is BF7. And we have seen that during the earlier first wave, second wave and third wave, we have great experience to handle all these COVID cases. We are conducting mock drills, we are conducting training sessions, we are updating our staff about the new mutant variant. There is no need to panic right now because our system is much better than China.
India is all geared up, and as Dr. Suresh Kumar has also said that we are already conducting mock drills, we are holding meetings with the governments, and we are all set to defeat COVID once again. There is no need to panic, but we have to maintain social distancing and we have to follow the COVID protocol.